Well, we are back with Cone Health cardiologist and clinical integration officer for Cone Health Center for Health Equity, Dr. Cardi Taub. We're talking about all things blood pressure related. So let's get on this. If someone is identified as high risk for blood pressure at the event that we just talked about that's going to happen on Saturday, what would be the next steps?
So there are many things that we're going to do, one of which is connecting people to care. So when you come out and you get your blood pressure checked, if it's outside of the range over 130 over 80, the first thing we're going to make sure that, do you have a primary care provider? And right there at that event, we're able to connect people to care. So if you don't have a primary care provider, we really want you to come out because we have that ability to connect you to care. We have that ability to make sure you're seen within a timely manner. So it's going to be something that we're not going to leave you unattended. We're going to make sure that you get that. We're not be prescribing medications that day unless if we have a physician on one of our mobile medicine thing, which we're planning to do, and make sure we get all of that in place. So please come out, because if you don't know what you have, there's no way we can treat you. Hypertension is a silent killer, as we said. The complications can come after the damages have been done. So let's get you screened. Think about the high-risk people I mentioned. If you smoke, if you have family history, if you use a lot of salt, meaning increased sodium, if you like exercise, please come out, because we really want to make sure our communities are healthy and just do it for the years to come.
All right, when we talk about high blood pressure, a lot of times people have medication that they use to keep it under control, but there are things that we can do to delay needing that kind of medication or reduce the amount of medication. Let's talk about those things.
So what happens when you get elevated blood pressure? It could be anywhere between 129 to 130 or a little bit over 130. It's usually a discussion with your provider. So sometimes when you're over 140 or over 160, it's really hard to say use other mechanism, because at that time you really need the medication to avoid damages. But when you're elevated, not over what we call stage 1 high blood pressure, we really talk about exercise. We talk about cutting down on the salt. We talk about eating healthy fruit and vegetables. We talk about managing your stress. What does that look like? We talk about cutting back on alcohol. So lifestyle modification, we call that. Working closely, though, with your provider and making sure that they're checking your blood pressure as those things go along. But there are times where we cannot delay medication starting because the blood pressure is so high. And if we delay that, complications and damages could be done to the heart that we can't really repair or come back and fix things like that. So those are the things that I really want to stress, that you can do lifestyle modification, but it really is a discussion with your provider as well.
All right, so often we have some friend of the family or whatever that has a blood pressure cuff, and so they may be talking about it. We may take our blood pressure there, or we may get it done at the CVS or something like that. If we do something like that, what's the normal level that we're looking for?
Ideally, we want the blood pressure to be less than 130 over 80. The closer to 120, the better. If it's less than 130 over 80, that's good. If you go for the first time, it's over 130 over 80, try to get it 2 separate times. Those 3 times when they're high, you really do have a diagnosis of high blood pressure. If you don't have a provider, you want to really make contact and get a primary care provider. If you do, you really want to stress with them that this is what you've been doing in your setting and that's the number that you're getting, and they can recheck with you. And if you're going for that recheck, bring the machine with you, the blood pressure cuff that you're using at home, so they can be able to cross-check it to make sure, number one, the batteries are good, it's working, and really see that you're using good techniques on getting your blood pressure done.
Well, speaking of that, should you put it on one arm versus the other? Should you be standing when you check your blood pressure? Should you be sitting?
Ideally, you should be sitting legs uncrossed. You can use either arms, but left arms a lot of times. Make sure that you have not had cigarettes within 30 minutes or alcohol. Make sure when you first sit down, you rest, calm down. If you sit down, usually 5 minutes, and then you get that blood pressure done. But definitely you want to do it before you eat, not necessarily after. So those things affect the physiology of the vessels and the blood flow, which can also affect the blood pressure. So you want to do all those things. Be in a very nice, calm, relaxing environment when you do that. And when you do that, like I said, 3 times, you really experience that. However, though, if it's 160 over 80, please don't wait 3 times. Connect with your primary care provider. If you don't have one, on our website for our PCPs, you're able to have open schedules to get primary care provider and come out on Saturday.
Right, and we've got a little bit less than a minute. I'm just wondering, what is the blood pressure reading that you should call 911 immediately?
I would say over 180 systolic and 110. Please call 911 and make sure that you're being taken care of, because at that point you want to get it rechecked immediately, and you want to be able to get taken care of.
Gotcha. Okay. Well, as we are going to throw to the break, let's put up that information one more time. It is Saturday. That is the free clinic. It's going to be 11 to 3 at the Corbett Sports Center.